Thank you, Chairman. Are you both here testifying on behalf of your agencies?
Yes.
So you're speaking officially when you give your testimony. It's not personal views, it's FDA and NIH.
Is that true?
I'd
hope
identify
so.
anything that was a personal view of mine, yes.
The one just factual question, Dr. Throckmorton, your testimony is that at the request of DEA in 2001 and again in 2006, FDA conducted a review of the 8-factor test for scheduling marijuana. Are you conducting that review for DEA now?
As a part of the citizen petition responses that I mentioned in my testimony, the DEA asked the FDA to conduct another 8-factor analysis, and that 8-factor analysis was performed and did include a review of all of the available scientific literature at that time.
And what, did it draw a conclusion?
We did draw a conclusion.
What conclusion did you draw?
Like we talked before, because our recommendation goes to HHS and then to the DEA, who makes the final decision, it's not something that I'm able to talk about at this time.
Because?
It's pre-decisional. The DEA takes our recommendation along with other factors and then makes that final decision.
From a practical point of view, assuming that the purpose of this hearing is to consider reducing marijuana from Schedule 1 level to Schedule 2 level, not liberalization of marijuana laws or any of the beyond that, what do you believe the practical results would be from a research perspective and from an abuse perspective of that simple step to have it be Schedule 2 instead of Schedule 1? Dr. Weiss first.
Well, there are certainly additional barriers or additional hurdles that have to be passed for somebody to do research, and
So
we
from
also
a research
for research purposes
perspective, it would be
it would be helpful.
reducing some obstacles. It would be helpful to have it go to Schedule 2.
Yes,
Okay.
or it would, well, I'm sorry, may I just step back for a second? There are certainly obstacles that are associated with Schedule 1. Whether the only solution to that is to move it to Schedule 2, I would not be willing to say at this point.
I didn't ask you to consider other options, just if you move from Schedule 1 to Schedule 2, conclusion 1 is that it would facilitate research. And on the abuse side, how much do you think the difference between Schedule 1 treatment and Schedule 2 treatment would open up the floodgates to marijuana abuse?
It would depend, because if it were made Schedule 2 without any FDA approval for any kind of medical use, then, which would be the situation because it has not gone through the FDA process, then it would still be illegal for abuse. It would still be illegal to use. However, the message that would be given to people around the country would be that regardless of whether it had been approved by the FDA for medical use, that would be the message that many people around the country would take, that if it were moved into Schedule 2, that it had a medical use.
Could you
And that could
tell me
that
some of
could
the other
increase-
drugs that are Schedule 2?
Excuse me?
What are some of the other drugs that are Schedule 2?
Amphetamine, methamphetamine, cocaine.
Methamphetamine and cocaine, you think, send a really strong signal by being on Schedule 2 that they're okay to use?
No, I don't think that, but I think that those drugs, but I think that there are many issues around marijuana that are more subtle than they are for methamphetamine, for example, that make it a very challenging drug to talk about and to convince people about its harms, despite the fact that we know a lot about its harms and the fact that it is an addictive substance and can affect brain development.
Dr. Throckmorton, same question. From a point of view of research, what would the move from Schedule 1 to Schedule 2 do?
Well, so there are two things that people have suggested, and I think Dr. Weiss mentioned both of them, that would be would change if marijuana was moved from Schedule 1 to Schedule 2. One, there are registration requirements for Schedule 1 products that don't exist for Schedule II, so they would go away. Now, they're there for a reason, so it would be important to talk to DEA and understand, the rationale for those to exist. The second is perception, and there is a perception that being in Schedule I, marijuana is somehow less attractive for research, and I've heard that, and I think Dr. Weiss has heard that. Changing that perception, I think, has the potential to be powerfully important as far as supporting better research. And again, my goal in terms of drug development is to get more people to be doing the kinds of studies that we want to have to develop drugs. One other small point.
Why don't I, since I'm over my time, interrupt you at that point so that other senators have a chance, because both our chairman, Senator Grassley, and Senator Klobuchar from Minnesota here.